Hi, my name is Crystal McDaniel, and today we're going to be going through 3 pieces of equipment that I can use with my client. Her name is Angie. She's a 36-month-old and she's diagnosed with cerebral palsy spastic diplegia. Her lower extremities are more involved than her upper extremities. She uses adapted stroller for functional mobility to get throughout the community. She does bunny hop on the mats in the clinic and at home, and she is able to sit upright with minimal support. So I'm going to be showing you 3 devices or pieces of equipment that we're going to go through and talk about their safety while using them. But in her case study, she is not diagnosed with any seizure disorders, so these swings will be appropriate and safe for her to use. Okay, so for our first piece of equipment that we're going to be using today, we're going to be using this stability ball, and this is going to be little Angie. So the reason that we are using this stability ball is since that her lower extremities are more involved and they do have higher tone and less function than her upper extremity does. So by placing her on the stability ball, it will help decrease some of the muscle tone that she is experiencing in her lower extremities. And since she does require minimal support in a seating position, this will also help with her trunk control and help increase that strength. And since she does enjoy bouncing and bunny hopping, this will hopefully be a motivator. And also, since she is 3, we can give her things that she may be interested in playing with while we are playing on the stability ball. So we can do something like coloring and putting it up on a wall and just taping it there, or giving her different like Beanie Babies and things like that just to kind of reach for so that she can practice working on that. So we're gonna go ahead and put little Angie over here onto the ball. Okay, Angie, are you ready? Okay, so we are going to go up on the ball, So we're gonna have her walk, 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 walk. And then I'm gonna see turn around and we'll have both of her hands. So first hand, second hand, and then we're gonna I will help assist pull her up, and we're definitely gonna have crash pads and mats and everything around us just for safety purposes. And then I wanna make sure that I have good body mechanics at all times. So I'm gonna be standing near the ball just to make sure that it doesn't roll anywhere. So if it's easier for me to have my legs in between holding it down and everything like that. So we're gonna go ahead and put her on the ball. And now that she's here, I'm gonna be holding around her hips. We'll go 5 little monkeys jumping on the bed. One fell off, whoop, and bumped his head. Mama called the doctor and the doctor said, no more monkeys jumping on the bed. So then after that activity has been done, we're gonna go ahead and be like, okay, Angie, all done. And we'll slowly take her off of the ball here and just roll her forward and then take her off. And like I said, we're gonna go ahead and just put the ball away afterwards, just to make sure that no other kids run into it. And we wanna make sure all safety for other kiddos when they come running into the gym, just in case another therapist isn't with them, that it's tucked away safely. So putting it up in a higher place or back on its shelf, wherever it go, it can be safe. And then, like I said, we had the crash pads and the mats all around us for safety purposes at all time. And then I did have my hands on Angie, since she does need minimal support. So keeping at least one arm around her, and me staying close by with that contact guard. And then we'll just sing and make her happy and keep her entertained with different toys. But that was our first one. Thanks. Okay, so now for our second one that we're going to be doing the frog swing with Miss Angie right here. So once again, these are her arms. This is the front of her body, and then we have her legs down here. But since we are going to be using a swing, it is important to follow proper body mechanics. So when putting the swing up, you do want to make sure that you're using your legs to lift and definitely avoiding using your back there. Also along that, making sure that your back is nice and straight. You're going to use a step stool or ladder if you can't reach. I'm pretty tall, so I'm lucky with that. And then also just to make sure that you support the heavy swings from the bottom prior to taking them off. So some of the heavier ones like the platform swings, you're definitely going to want to pick that up prior because it is such a heavy swing. Some of the parts here are going to be the steel eye bolt that's at the very top of our swing. Also, we're going to make sure that we want to attach our safety rotation device, since this is going to be a swing that is going to be moving a lot, and we do have the bungee for like the bouncing. We're definitely going to want to include that. We also do have the height adjuster. We're going to make sure that we use it to adjust it to the child's height. So Miss Angie here, she is 3 years old around there.
We're gonna match it up with around her knees so that it's safe for her. And then also making sure that the carabiner is upright and that it's completely closed, again, for safety purposes, because we don't want that coming off. Another thing too, we're gonna wanna apply enough mats around the area to make sure that everything is completely covered. Since we are on a swing, we do wanna make sure that she's safe at all times. So the mats will definitely be helping with that, and I will be on guard too, just to help. But this is an appropriate swing because it's for ages 3 and older, and since she is 3, this is perfect for her, and she is motivated by the hopping and the bouncing, so this will be a good engagement. So we're gonna go ahead and instruct Angie to get in here. So as she gets close, she's walking up. Okay, Angie, turn around. So we're gonna have her turn. So now we have face forward right here, and then Angie, one arm. So hold on. We're gonna get into swing. So one arm here, and then we're gonna go ahead and get that other arm. So now she has both arms and holding on. Okay, bottom down. So now that she's sitting, has her legs here, and we'll go ahead and we'll swing for a period of time. But this is good for her because this will definitely help increase that core strength. Since she does have a little bit of a declined core strength, and also since she does have the upper extremity strength, this will definitely help so that she can hold on. So this is also good for the proprioception and a good motivator for her since she does like the bouncing and the input from that. But this will definitely be helping with that core strength for her. So good job, Angie. And then once we're all done with that, to get out, we're gonna have, okay, Angie, hold on. So holding on here with both arms. So one arm, two arm. And the next thing we're gonna do is we're gonna instruct her to say body out so that her head's slowly starting to come out. And then we're gonna say bottom out. So then she's safely off and down. And then once Angie's done with that, also what we're gonna be doing is we're gonna go ahead and we're gonna take the device down. Just in case any other kiddos do coming in, we do wanna watch out for safety issues. So if they come in and there's no therapist with them, we don't want them hopping on, or if there's any seizure precautions or anything like that that we need to be aware of, just to get it down and then move it out of the way and have it ready for the next therapist setup. But okay, now we're gonna go on to our third intervention.
Okay, so now we're on to our third piece of equipment that we're going to go through with Angie. So far we have done and incorporated 2 different pieces of equipment that do have vestibular involved with it. So we do want to make sure that we're watching out for signs of indigestion, such as if they start sweating or if they turn pale or any of those physical signs, especially if they are a new patient. You always also want to make sure with the swing that you're moving in one linear motion first, and that it's just a single plane of motion until we actually get to know the client and know that they don't have any indigestion or anything that may occur, because that could happen hours later. And like I said, don't put them on the swing if there's any seizure precautions or if it's not monitored by any medication or anything like that. So for my next activity for Angie, since she does need help sitting in an upright position, I did want to have something to kind of help that. So my next activity is going to be using this wedge. This is going to be the higher side right here, and this is going to be the lower side. So we're doing this because the other 2 were like vestibular and proprioceptive, just to do something a little bit different. I did want to pick this more stationary item just in case it did get Angie any like riled up or any indigestion or anything like that, just to avoid and make a calm activity. So we're going to be using the wedge here today. So what we're going to be doing is I'm going to have her sit on the edge of the wedge, this side that's up a little bit higher, just to kind of engage more of an anterior pelvic tilt, or also that neutral position, just to kind of help, like I said, with like the trunk and posture control. So within this, as this is Angie, once again, this is her front, her 2 arms, and we got her 2 legs down here. So what I'm going to be doing just to kind of work on that trunk control is I'm going to be placing her over here on the wedge, and I'm going to be sitting around for support, and we'll have mats and everything like that surrounding her just to make sure that we have the optimal amount of safety. And another way just to kind of help give a little bit more resistance is going to be if you have kind of like a Dyson mat or anything like that, if we just simply place it on the wedge itself, so that way it'll cause a little bit more traction if she does, since she does need a little bit more support. This might help her from slipping backwards. So we're gonna go ahead and place that there, or you don't have to if she doesn't seem to be needing it. So over here, so like I said, we're gonna be putting her over here on the wedge and having her reach in different directions with me on close guard, and like I said, having the mats for safety around. So then that way it'll help kind of engage a little bit more of that trunk, just to get some more muscle strength built up. So we're gonna go ahead and have Angie here. So, okay, Angie, we're gonna have a seat. So we're gonna walk, walk, walk. Okay, turn around. And then from here, I'm gonna instruct her to slowly lower herself. So slowly lower. And what we're gonna do is use her arms just for kind of support. So go ahead, arm here. So she'll grab with her arm and then go ahead and sit down. Good job, Angie. Okay, so now that we're sitting here, I'm gonna have her kind of reach for different items. So she seems to be interested in any Beanie Babies or balls, kind of whatever she seems into at the moment. Just since she is only 36 months, just to kind of keep her engaged so we can kind of have a bunch of different things around. So I'll have her kind of reach to the side, reach forward, reach to the other side, just to, like I said, work that trunk a little bit more. And then once we wrapped up the activity, okay, good job, Angie. We're gonna go ahead and stand up. And then from here, just guide her to stand up so she can push off with her hands and off. So push one arm, other arm, and then we're standing. And then from here, we do just want to make sure that we put away all the equipment. So go ahead and just fold up the Dyson mat if you did end up using it and putting it away in a safe location. And then go ahead and removing the wedge so we can put it upright. Just so that no one runs into it, or put it in its storage place wherever necessary. And this, once again, just to create that neutral anterior pelvic tilt there and just making sure that it's helping engage her core. But those are all the equipments that we used for little Miss Angie. Thanks for watching.